Bismillah ar-Rahman ar-Rahim. Our lecture today about the disorder of the voice. Vocal fold polyps is the first and important pathology. A true vocal fold polyp is a benign swelling of greater than 3 mm in diameter that arises from the free edge of the vocal folds. It is usually solitary but can be affect both vocal folds. It is the most common structural abnormality that causes hoarseness, and it affects men more than women. They are most frequently seen in the smokers between the age of 30 and 50 years. The exact cause is not known, but phonotrauma is the important etiological factor. Histologically, there is a disruption to the vascular basement membrane with capillary proliferation, thrombosis, minute haemorrhage, and fibrin exudation. The patient may complain of hoarseness, or lowered in the pitch, or cuts out in the speech, or lost part of the range, or there is a strain in speaking. Very rarely, large polyp can cause difficulties in breathing and episodes of choking. Polyps can shrink spontaneously or even coughed up. Voice therapy can help but is unlikely to result in resolution of the polyp. Any concomitant inflammatory conditions should be treated. Most polyps need removal under general anesthesia. The aim to restore the smooth edge of the vocal cord, allowing them to close fully and vibrate. Differential diagnosis of polyp. If there is a gray, white, or translucent lesion, either true vocal nodule or physiological nodule, perinodular or prenodular swelling, pseudocyst, mucus retention cyst, epidermoid cyst, localized Reinke's edema, vascular abnormalities like ectasia. If there is a hemorrhagic lesion, either hemorrhagic polyp, ectasia, papilloma, carcinoma, arytenoid granuloma. This is a picture show hemorrhagic polyp. The second pathology is the vocal nodule. Vocal nodules are almost bilateral, and it is less than 3 mm in diameter, so it is different from the polyp. It is smaller. Develop also on the free edge of the vocal fold at the mid-membranous portion between the anterior 1/3 and posterior 2/3 of the vocal cord. It is characterized histologically by thickening of the epithelium with a variable degree of underlying inflammation. In children, they are more common in boys than girls, while in the adult it is more common in women. The etiology is not known, but it is caused mainly by voice abuse. Vocal folds are thought to impact on each other in such a way that repeated trauma of the midmembranous portion lead to the localized swelling and epithelial thickening. Psychological factors, nasal, throat, and chest infections, allergies, and extraesophageal reflexes are important in etiology of the vocal nodule. Nodules disappear spontaneously in boys with the growth of the larynx in puberty, but in girls they may persist into the early adulthood. The voice quality often husky and breathy, worsening with voice use, and there is a perilaryngeal discomfort or sore throat on phonation. The voice may become a little deeper in pitch, like man, and associated with voice break, particularly at the higher end of the range of the voice. The vocal folds are usually hourglass in appearance, with often only the nodules making contact at the midmembranous portion. This picture shows the hourglass appearance of the vocal cords. Treatment: if the nodule is not symptomatic, left alone. Any aggravating factor such as allergy, chest infection, nasal infection should be treated. The mainstay treatment for persistent vocal nodule is the voice therapy. Complete and rapid return of the voice function is only possible if the nodule exists, so the surgery only for failure, symptomatic cases. Significant number of nodules recur if surgery is performed without voice therapy. The third important pathology is the Reinke's edema. Reinke's edema describe a vocal fold when they become chronically and irreversibly swelling. It is occur almost exclusively in smokers, voice strain, extraesophageal reflux, and may also play part in the development as a cause. One of the causes is the hypothyroidism. This is another picture for Reinke's edema. The most common symptoms are deepening of the pitch of the voice, with the woman often being mistaken for a man. Second, effortful speaking. Third, inability to raise the pitch of the voice, choking episodes, other symptoms associated with extraesophageal reflux. The diffuse lesion of the membranous part, only just the membranous part, of the vocal fold are bilateral in 60 to 80% of cases, although they may be asymmetrical. Typically, the vocal folds are gray or yellowish in color with a prominent superficial vessel. Alternatively, edematous fold may appear diffusely red when coexistent extraesophageal reflex is present. In severe cases, the vocal folds look like a bag of fluid that flop up and down through the glottis with respiration. This picture shows the Reinke's edema with prominent vessels, and it is semi-completely obstruct the airway. The decision to treat the patient depends on the symptoms, the severity of the edema, and the presence of leukoplakia. We first start with conservative treatment such as reassurance, vocal hygiene, smoking cessation, hypothyroidism treatment, upper airway infections and allergy and extraesophageal reflexes should be treated. Second, surgical treatment should be indicated when there is leukoplakia and histological diagnosis is required because of the risk of carcinoma formation. Gross Reinke's edema is present and causing choking or airway obstruction, pitch elevation of voice in women. Patient must be aware that after surgery, friends and relatives may not recognize them by their voice, singing voice may be permanently altered, speaking may be more effortful for up to 1 year or occasionally permanent. The Reinke's edema is likely to return within 2 years if the patient continues smoking. Other pathology is puberophonia, the voice that appears to be too high in pitch for the individual age and sex. Normally, at the puberty, the voice drops by an octave in boys, but only 3 to 4 semitones in girls. In boys, the transition takes from 18 months to 3 years and is usually completed by the age of 14. This voice change in puberty is accompanied by pitch instability. Treatment is voice therapy, occasionally botulinum toxin injection into the cricothyroid muscle have been shown to be effective in resistant cases. Another pathology is the arytenoid granuloma. Arytenoid granuloma are a benign inflammatory lesion, arise in the medial surface of the arytenoid cartilages, and in particular the vocal processes. These consist of proliferation of the granulation tissue with epithelial hyperplasia. They result from injury to the thin mucoperichondrium over the vocal process from mechanical trauma, either following intubation or repeated high-velocity impact of the vocal processes against each other, from throat clearing, coughing, talking in habitually low-pitched manner. This is a picture show the arytenoid granuloma. Men tend to develop granuloma secondary to the hyperfunction, mean over-talking, while the women develop them more commonly as a result of intubation. In addition to the extraesophageal reflex is important etiological factor, either contributing to the symptoms leading to the mechanical trauma or prevent the healing of the damaged mucosa. Patient present with a change in a voice and or vocal fatigue, discomfort or pain localized to the posterior superior aspect of the larynx, which is worse on phonation, coughing and throat clearing, and can radiate to the ear. There may be symptoms associated with extraesophageal reflux, including choking and, in severe cases, stridor. They may be unilateral or bilateral and range from nodular diffuse thickening over the vocal process to large pedunculated exophytic mass. The main treatment is to stop smoking, improving the vocal hygiene, treatment any respiratory tract infection, allergies, and extraesophageal reflux. Voice therapy, surgery, but it does not cure the granuloma when used in isolation, as there is a high rate of recurrence. It is useful in confirming the diagnosis, the surgery, confirming the diagnosis, and excluding the carcinoma. Laser vaporization after biopsy reduces the amount of bleeding, but it is cause thermal damage. Botulinum toxin injection into the thyroarytenoid muscle can be useful as adjunct treatment as help to reduce the impact of the vocal processes against each other, allowing the epithelium to heal. Thank you.